We are looking at the world through the eyes of persons living with HIV. At a time, the world has shifted its focus from the epidemic to the coronavirus pandemic. As of 2020, UNAIDS estimated COVID-19 disruptions could lead to over 500,000 related deaths in sub-Saharan Africa alone. So what has changed to persons living with HIV to what has been dubbed the new normal? We shall also be looking at the unending war on stigma and the gains that have been made so far on preventive treatment. This week on Frontline and on my debut, we put a special focus on HIV and AIDS. My name is Lincoln Ombogo. Now, the coronavirus has disrupted the fight against HIV and AIDS, with patients facing challenges not only medically but also economically. From Mukuru Kwanjenga, Rachel Ndwati gives us a story.
Living with HIV and AIDS has been characterized with a lot of stigma. Now think about living with HIV and AIDS during a pandemic where more emphasis has been placed on the coronavirus instead of advocating for the HIV and AIDS patients. Today, I interact with residents from Mukuru Kwanjenga who tell me the challenges they have been facing on the same. My journey begins here at the eastern side of the Mukuru slum. As any other slum, people living below the poverty line have low living standards. My first encounter is with David Wamalwa, who has been living with HIV for the past 10 years. He says that since the pandemic began, the challenges have been numerous, from living standards to accessing health care.
Tumekuwa na wakati, ndio imekuwa na wakati mgumu, lakini ni kujipa moyo na kujaribu tu vile unaweza kujikimu kimaisha. Hata kama ni ngumu, lakini unatafuta, ikipatikana unashukuru, lakini imekuwa ni ngumu.
On the 15th of April, the situation went downhill as Kenya experienced an acute shortage of antiretroviral drugs when the USAID, which exports the ARVs, halted supply from the Kenya Medical Supplies Authority over corruption allegations. This forced public hospitals to ration out dwindling supplies. Raising children in a pandemic while being HIV positive is not an easy task. Roslyn Azinza knows this ordeal very well.
Nimefanya hii, ninawasomesha tu kama niko mgonjwa hivi. Nimewasomesha watoto wangu hapa karibu 3. Wamemaliza form 4 kama nafulia watu nguo. Sasa wakati corona imekuja, unajua unaweza kujikuta huko mambo mbaya. Wakati corona imekuja tukakatazwa hatuwezi ingia estate kuvua.
The ARV drugs impending crisis is a reality for many, and Roslyn worries that her source of survival in beating opportunistic diseases could be at danger. Retaliating the hardship, Eric Ambute, who is the founder of the Slums Outreach Program, narrates how dire the situation in Mukuru is in accessing treatment.
When corona hit, especially when there was some shortage of ARVs, it was a big challenge for these patients.
Now, another concern is on vaccines. Although the World Health Organization declared vaccines such as the Pfizer and AstraZeneca as safe for people living with HIV, Frida Nyongesa says she is unsure about taking the COVID-19 vaccine.
Hapo siwezi nikakwambia nitachukua kwa sababu tunapatanga mafunzo kutoka huko kwa hospitali, hawajatuambia tuchukue.
Those people living with HIV and AIDS are a group of people living with underlying conditions. Clearly, more needs to be done to create awareness and inform them on the benefits of accessing health care. Rachel Ndwati, Switch TV.
Now, have we forgotten more about HIV and focused on COVID-19? Are the gains we have made being eroded? We see through the lenses of Kimutai Kemboi living with HIV and a HIV program coordinator in Dagoretti Sub-County, Douglas Kibande, to delve into the discussion. Thank you both for joining us. Now, Kimutai, after seeing that story, how is your experience been seeking medication during this time of the pandemic?
It has really affected a number of us, but I would like to say that it has not affected me in a direct way, but it has affected me indirectly.
How so?
Reason being, where I get my medication, I think there was a regular supply, or rather the drugs and it never went out of stock. So I accessed my medication with ease and just like any other day. But now the problems, the problem arose, especially those who are close to me, especially and those who are accessing these drugs from and different clinics, and also others are maybe especially during the lockdown, they were locked like outside of Nairobi. So now accessing drugs was an issue with them. So I had to go an extra step, maybe go to their clinics and get drugs for them and send for them. And sometimes maybe you have to look for a way. Let's say a place where you can refer these clients in the places they are. Maybe they're in a different different place. Let's say and not close to where you are. So you have to look for a place where you can access that medication.
Kimutai, have you had to adapt or make changes during this COVID pandemic period?
Yeah, sure. Life has not been the same again. Because initially used to interact with different people, especially when you go to clinics. Sometimes we had support groups, but right now because of the restriction of having a crowd of people is really hard. So I really miss that life whereby you get to interact with with your friends, with your colleagues, and also those you let's say you share the same status with, when you interact with them, you share a lot, you interact a lot, and life is just you are not alone in that field. But now, due to the restriction and all that, life has had to change.
Douglas, thank you for creating time. Douglas is the HIV Dagoretti Sub-County Coordinator. Douglas, maybe I'd like to ask you, are people living with HIV and AIDS more likely to get severe complications of COVID-19?
Thank you for that question. Essentially, it depends. And so far, what I would say at the outset, there are still studies still evaluating that fact. But of course, if you are HIV infected, if you are adherent to a treatment as it is required, then your risk profile is essentially almost like would have any other person who's not HIV infected. However, having said that, if you're not adherent to a treatment and then you start getting opportunistic infections, then invariably so your risk increases of getting COVID if you have HIV. So it really depends on your status in terms of adherence to treatment.
Douglas, has the fight against COVID-19 sidelined HIV and AIDS?
Well, of course, at the outset, there was a lot of interest, a lot of excitement about COVID. But as you know, the government, we have program officers on the ground in respective areas. So, of course, when COVID struck, then each program had to ask itself, how is it going to affect our program? Mm-hmm. How are we going to manage it? So we took necessary steps to mitigate the effect of COVID. When we know, again, one thing that you want to know is that even the labs that were being used for testing, most of them are also being used for HIV. So the government did come up with a stringent mechanism how to undertake both of them at the same time. So the program officers on the ground were able to put in place mechanisms to mitigate that impact.
Douglas, Kenya intends to manufacture ARVs. Do we have the capacity? What will that mean for Kenya?
Well, that will be a good thing. And when you look at our country at the level of development where we are, I can confidently say that we can manufacture our own ARVs. In fact, we have companies locally which are venturing in that area. And of course, that would mean a reduction in cost of production and access to treatment for more people. And then also, it's a move towards self-reliance in terms of HIV care management. So that would be a welcome move. And it's very, very possible.
Kimutai here spoke of stigmatization. He is lucky enough he has not experienced stigmatization. Are people still experiencing stigmatization in 2021?
Yeah, that's a good question. And it all depends, because stigma has various facets of it. There's initially the self-stigma, how we feel about ourselves when we're infected with HIV. Sometimes we may feel that other people know and start stigmatizing ourselves. However, there's also felt stigma expressed by other people towards you. So efforts are being made towards that, with a lot of awareness creation being done, a lot of treatment protocols being improved, so that the face of HIV is changed, so that you don't see that emaciated person with HIV, but a well-nourished person living with HIV confidently. Stigma is still there, but efforts are being made towards mitigating it and normalizing HIV so that we do not see it as a monster, but it's integrated within our healthcare system so that the services are accessed the way you would access the other services in healthcare. So really it's there, yes, but efforts are being made towards making sure that the level of stigma continue reducing until such a time that HIV will be acceptable, just like another diagnosis such as hypertension, diabetes, and the likes.
Thank you, Douglas. Kimutai, are there certain things that people with HIV and AIDS don't want to hear about?
Yeah.
I don't want people to talk about?
Yeah. Especially there are some terms that maybe they use that are discriminatory in a way.
Like what?
Like now, right now, there is a difference between HIV and AIDS.
Mm-hmm.
And HIV is just is like a condition, but AIDS is when it is advanced, like you have contacted other opportunistic infections, like your health has really deteriorated. So now, when you refer to someone living with HIV like he's living with AIDS, it's look discriminatory now, and it doesn't really sound good. So I think we should be a bit sensitive in the terms that we use. At times you hear, it may be someone has been exposed to something, you hear others saying like he has stepped on a live wire. So, like some terms really doesn't sound that good. So we should really try as much as we can and be fair in the terms that we use.
Douglas, lastly, what is the one thing you'd like to tell our viewers, especially one living with HIV during this time of the pandemic?
Well, it's just to assure them that the government is doing all that it can to make sure that they are catered for. In most facilities, there have been arrangements put in place to make sure that the drugs are available, the tests are being done for viral load on regular basis, and the support that is required in terms of course, social support and others, they are ongoing. Despite the fears about the drug supply, of course, the government doesn't rely only on one supply chain stream, that is PEPFAR, but we have others, such as the Global Fund, which come in. So the drugs, the consistency will be there. They need to be assured that, of course, the anxieties of COVID may be affecting the other socioeconomic factors will be there. But in terms of healthcare delivery, in terms of them accessing their medicine, this is going to be done well, and they should be assured that they'll be taken care of.
Thank you so much, Kimutai and Kemboi. That's Douglas Kibande for joining us. We now take a short break. On the other side, we'll have Patricia Tironi, who helps female sex workers access services to lower the rate of HIV infection. Do not miss. Welcome back to Frontline here on Switch TV. Now, 40 years later, we are still grappling with the issue of HIV, with infection rates defying the amounts and resources spent on prevention measures. Our very own Harriet Chimere explains.
The ARV saga in the country has adversely affected HIV and AIDS patients in the country. This stalemate has been in place for over 4 months after the USAID and Health Ministry had a standoff over giving KEMSA the mandate to supply the drugs. But how many people really are in dire needs of the drugs? We narrowed down to Africa, specifically Kenya. According to UNAIDS data 2020, 1.5 million people of the 47.5 million in Kenya are living with HIV and AIDS. The number could be bigger now, with fears that the gains made over the years could be eroded. As if the new virus is not enough, it has slowly made us forget the old HIV. It continues to be a major public health challenge in sub-Saharan Africa, where an estimated 22 million people are living with HIV. As of 2020, UNAIDS estimated COVID-19 disruptions could lead to over 500,000 related deaths in sub-Saharan Africa. Out of 38 million people globally living with HIV and AIDS, 13 million do not have access to antiretroviral therapy. On the flip side, deaths have fallen in large part due to the rollout of antiretroviral therapy. AIDS-related deaths have fallen by 43% since 2010 to 690,000 in 2020. And those are the facts.
Now, in studio, we have a counselor psychologist, Bridget. Bridget, let's get your quick reaction on this. How the figures, I mean, are those living with HIV feeling left out on the onset of COVID-19?
Yeah, what I can say, since the COVID came in our country, the cases of COVID came in our country, it has been like the people living with HIV are forgotten. The reason why I'm saying this, like now you see the Sangha, which is at Mombasa port of ARVs drugs, they are still there. So the reason why I'm saying they feel like they have been left because where I work, you find several questions are being asked by the patients.
Like what questions?
Yeah, they ask, like now when they come and we tell them about compliance and self-care, so they ask ourselves, how would you tell me to adhere to the medication, and that yet the medication are not available. So some feel it's better they have died than living in the country because
how do you address
they feel
such an issue, Bridget?
Okay, what we do, we work with them through that journey of stress. We give them counseling, we support them psychologically, and we work with them through that journey. And we also assure them maybe one day, one time, a government will do something on the medication.
Are there some who miss medication, and what are the effects if you miss medication?
Yeah, some miss medication, and we have several defaulters who started defaulting since the COVID, the ARV saga came. And what happens to the ones who default? You find their health continue deteriorating, and some they start developing the OIs. So they becoming weak and weak, but later they are being brought in our hospital very weak. So we manage them and we work with them through medication, psychosocial support, and also nutrition. Because even in where I work, we have a feeding program to help the ones who are not able to buy food for themselves. Because now you find nowadays many people have been affected by the COVID since some they are jobless. So that is what we do for them.
Thank you very much. Now we'll be talking to Patricia via Skype. Thank you, Patricia. Thank you for creating time. Now, at the Drop Service Center in Kitale, female sex workers come in seeking help to avoid contracting HIV. How do you help them?
Yeah, basically we use a combination prevention package to reach out to workers. We have the biomedical component and we have the behavioral component. So whereby in the behavioral part, we have trained peer educators who are also sex workers who have been trained on various behavioral packages to offer services to the female sex workers in terms of health educations. And also we have now the biomedical intervention whereby we incorporate the drop-in center. We offer the biomedical services to the female sex workers where they can access family planning services, PrEP. We offer antiretroviral therapy. We also have a safe space for the female sex workers also to share their experiences and also to share one-on-one on the issues affecting them and the issues resulting to HIV/AIDS. So we've created a safe space for them whereby they can have health education session there, can free to access services at the drop-in center. So we have an operational dice with the clinicians and nurses and also the HTS counselors to offer counseling.
Thank you, Patricia. Since the onset of COVID-19, how many people have you reached? And I mean, what are some of the challenging stories that they come in with?
Yeah, it was for the past 1 year, that is in 2020, when the pandemic struck in the country. Sex workers were affected adversely and major services were interrupted, whereby most of the hotspots, that is the bar and lodges, were closed, where they have been operating. So amidst COVID-19, with the help of the Kenya Red Cross, who are also our donors, and with the help of the Global Fund, we identify ways whereby sex workers will be reached with comprehensive services. We organized for the mobile wellness van outreaches and also hotspot-based outreaches, whereby we targeted FSWs who are in various areas, and we managed to offer services to them. For those who are on care, on ART, we organized in such a way that our social worker ensured that they received the antiretroviral drugs for the 3 months. So we staged a way in such a way that sex workers were reached with services.
Thank you very much, Patricia. Thank you for creating time at this juncture. As a society, how are you working to break barriers that hinder HIV treatment and services, and what have you achieved so far?
As a society, our main role is, as auxiliary to government, our main role is to support government in the strategies and policies that they have come up with. We do a lot of work with the government of Kenya, both at facility level and at community level, to support implementation. But I want to speak clearly around the Global Fund, where the government is the main implementer at facility and county level, and Kenya Red Cross is an implementer at community level. And our role, therefore, is to, one, mobilize communities around health promotion, health education, and also creating awareness to create demand for facility services. So for the people living with HIV, we therefore create demand for testing, and we also conduct community level and door-to-door testing. And whoever tests positive, we then link them to the facility for services, because then they are provided services at facility level, whether it is full ART support or whether it is other diagnostic tests. And then we also work with community health volunteers that we train, and we attach to the people living with HIV to support them in treatment, because treatment cascade is a long process, and therefore anybody going through that treatment needs a buddy to support them through the treatment for adherence.
How about the need to attain universal coverage for HIV prevention and treatment? What challenges and milestones have you made so far?
In terms of trying to get universal coverage, let me look at it from two perspectives. The first perspective would be the healthcare services, which is looking at the provider perspective. The provider perspective has been having challenges of shortage of staff, also issues around equipments for other services, because HIV services is not isolated. So as much as HIV services in this country has enjoyed the donor support and therefore has a lot more than what other diseases in the country has, but they are not, the infrastructure that we have in the country has challenges in terms of ability to access everybody, both in terms of geographic location, because our facilities sometimes are far from other people, especially those in rural and those in hard to reach areas, and also in terms of people getting to the facility, because we Kenyans are like other Africans, we are not health seekers. So rarely do you find somebody going to a facility unless they are sick. So with an HIV positivity status, you're never that sick all the time. And so this has also made people not be able to go to the facility at all times. So infrastructure, access, both geographic and population access, and also human resources are the main challenges of universal access at facility level from where I stand. Though there are many, but those to me are key.
For Frontline this week, it's a wrap. I have been your host, Lincoln Obogo. Many thanks for watching. Stay safe and have a blessed week ahead.